My name is Corinna Taverna, and I had my second knee replaced, my right knee replaced on August the 9th, 2017 of this year at the Holland Clinic, which is part of Sunnybrook. And after the surgery, I developed some very strange side effects, I believe, to the anesthetic. I developed delirium. Yeah. I remember shortly after I woke up from the surgery, feeling very, tired, and that's pretty normal. But then shortly after that, when I was trying to talk to my husband, he was there, I couldn't put sentences together, I couldn't express what I wanted. And the oddest thing to me was that he even said it to me afterwards, but I remember doing it. I couldn't speak in English. I was speaking to him in Italian, and my husband's not Italian. And though he understands a bit of the language, I would never speak to him in Italian. So that was really odd. And I remember thinking I wanted the words to come out in English, but they didn't. I remember I don't know, I kept on seeing things as well, and sort of like in my peripheries, and I would turn around to look, and I would see things, and then I would look, notice that nothing was there, and then return to resting or whatever, have my eyes open, same thing would happen. And then later on, like that same day though, and into subsequent days, I stayed in the hospital, I believe it was 4 days or so, hearing voices, and I would look and see that somebody was there and nobody was there. And so those are the main things that I remember, just the total disorientation of hearing the voices and seeing things that were not really there. And then at the very end, I remember that the nurses, I guess in consultation with the doctors, didn't want to let me go home because of that. But I needed to go home. I just wanted to. I was just I wasn't feeling well. I thought maybe it would help to be home, and so I remember signing that that was my decision, and I was sent home. What you said would help, someone that says to you, okay, this is what might happen, and if you do feel this way, just tell us about it, we'll help you through it, and so on. It may be rare, I'm not sure, but it is what may happen, and if it does, then we will help you through it and help you achieve a level of calmness that will help you get through this whole thing. So that would definitely help. And I find as well that what might contribute to this is the level of pain that you're in. And so I know I can tell you from double experience, knee replacements are so very, very painful. Basically what I'm saying is that I was fighting the pain and trying to sort through the mental confusion that I felt. Yeah.